We started 2.5 years ago, the DETECT trial. So it was a pilot randomized controlled clinical trial. It was performed only in our center. So we did this pilot phase trial because we wanted to see if it is feasible to do a full scale RCT to test whether intensive blood pressure control can improve patient outcomes after endovascular thrombectomy. So what we did find out in a nutshell, we included 30 participants. Our enrollment rate was less than anticipated, so it was half the rate that we're hoping for. And this was mostly because the patients, they were normalizing their blood pressure after endovascular thrombectomy. So more than 60% of the screened individuals didn't get into the trial because their blood pressure just normalized after the endovascular thrombectomy. So that's the one finding. The second finding is that it's really hard to keep the blood pressure within target. And it is really hard not only for the intensive arm, but also for the control arm, because the patients, they normalize. So although we're hoping to see that 80% of the times we'll see the participants being in the assigned BP target, in the intensive arm, we did pretty well, but when we're looking at the control arm, we can see that less than 50%, they were staying above 140. So that's the other important message of the trial. And the unique part that we did in DETECT is that we did a transcranial doppler in patients after EVT. We explored whether there was a difference in the systolic velocities, the peak systolic velocities and the mean flow velocities in TCD between the two groups, and we didn't find any evidence. Of course, for the last one, the numbers were very small, so probably we're not adequately powered to show any difference. But again, we don't have any suggestions for any difference between the two groups.